Rituximab treatments. It is a molecule commonly used nowadays in treatment of the different rheumatological disorders, immunological disorders, and collagen disorders. So, what it is? It is anti-CD20 monoclonal antibody and works by B-cell lympholysis. Mostly you check it by seeing the CD19 status before using it. Actually, rituximab is it affects the T B cell cross top, and it also affects your T helper cells and T helper 17 cells. So thereby it is an immunomodulating sort of things, and thereby the immunological phenomenon are being taken care of. And the people used to also say the podocyte cytoskeleton alteration, actin produces the filaments, they are also being looked upon by this rituximab. So mechanism is this, and then normally what happens? Normally B cell produces plasma cells and secretes IgM, IgG, IgE, and A in sequential manner. You call it the switch phenomenon. The B cell is under control by T helper cells and cytotoxic cells, CT and the regulatory cells, T regulatory cells. They prevent the helper cell helps in the B cell producing the antibody. So this is the normal immune mechanism. Like rituximab binds with the CD20 of B cells and helps in the lympholysis or apoptosis. Thereby it is a B cell lytic monoclonal antibody. Dose is 375 milligram per square meter per dose, given over quite a long time, and once in a week for 2 to 4 doses, depending upon the need of your patients and indications. But you can also give double dose in the longer time, 750 milligram per square meter per day for twice, 2 weekly, and along with it, while you infuse, you give antihistamine avils in dexamethasone to prevent your infusion reactions. Before infusing the rituximab, what you do, we check the hepatitis B virus status, HBsAg, liver status, ALT, and blood count, high immunoglobulin CD19, and HIV status. So there must be adequate cell count, and there should not be any disease in the other organs, as I said, because rituximab can cause hepatitis, B cell activation, C cell activation, Eve activation, and your pneumocystis jirovecii infection, pneumonia, infusion reactions with chills, fever, rigor, and bronchospasm is possible. Acute fetal pulmonary fibrosis, lung injury is possible, and polymorphinuclear leukocyte count can low down, and you may have the hypergammaglobulinemia, at times an inviting infection, jirovecii, pneumocystis jirovecii infection, and rare side effects like multifocal leukoencephalopathy is also possible. So monitor these cases after infusion by CBC, the clinical pneumonia, and ALT, and give the cotonoxazole prophylaxis 5 milligram per kg per day and every alternate day for 3 to 6 months to prevent pneumocystis infection. And late sequelae are not described. In that way, it is a fantastic new drug, new molecule, useful in plenty of diseases, including nephrotic syndrome in children, lupus nephritis, your other collagen diseases, GIA, and plenty of other diseases. So its use is the current fortune or favor for the people throughout the globe.